we're coming up on a huge shift for our healthcare system, so it can go one way or the other. So this is just not the time to try to pass a legislation like this. But furthermore, we have some information that might blow this whole case open, because what we see is that when the doctors take the Hippocratic Oath, I don't know if we all are aware with that, they take the first thing in the oath says that they will not prohibit any, or they will not give any type of drug that will kill a patient, and they will not suggest that a patient take any drug that might end their own life. So when we look at these two things, I'm not sure how euthanasia would even happen anymore. You know, this is the most humane way. There's no humane way to kill a person, but the most humane way would be injecting them with something or suggesting that they take something, which they can't do in the hospital anyway. So I'm not even sure how it would happen if we were to agree with you today and say euthanasia is something that we can go for.
Well, let me ask you this. You know, there's a such thing as involuntary euthanasia, right? Okay.
Passive.
Okay.
Yes.
Okay. Now, we have, like the Terry Shriver case. What do you think?
Talk to me about the Sherry Shriver case.
Is it Sherry? It's Terry Shriver.
Okay.
Yeah. Okay. She was similar to the situation I was sharing earlier about. I have a friend who had a wife who had a stroke. She, the part of her brain that will wake her up was destroyed by the strokes. She continued to have these many strokes that were destroying the rest of the part of her brain. Okay, they had her on breathing machines, they had her hooked up to feeding tubes, they had her to IVs with medication, and then they said, okay, we've done all that we can do, okay? Then they remove her from the machine thinking that once we remove this breathing machine, that's going to be it. She's going to terminate. Okay, but she does not terminate. She continues to breathe on her own. But she cannot wake up. She cannot think for herself. The part of her brain is destroyed. She will never wake up. What choices do we leave, you know, for families to, you know, make a decision about, do we allow them to continue in that state and the massive medical costs that it's going to cost to maintain a person who will never wake up again?
Listening to what you're saying, we have to understand that these are tragic cases, but this situation is too small and the case is too nuanced and fragile for us to cross-apply that to everyone who might be in that situation. So I understand what you're saying completely, but what we have to understand is that when we're talking about passing legislation, we can't take one case and cross-apply it to others, especially when we're dealing with something that is so. We've seen miraculous things happen. We've seen people continue to breathe. We've seen, you know, et cetera, et cetera. But furthermore, when you say that these hospital bills continue to rack up, that's one of the problems that we have with the euthanasia becoming legalized, because hospitals are very aware of that. And what they will easily do is start pulling those plugs and start to not do everything that they can do to keep a person alive.
Okay, I hear you suggesting that the slippery slope. Because that's what you're suggesting.
That's not what I'm suggesting.
You're saying that if we allow it to be, you're suggesting that it could become a slippery slope, but we're saying, oh, well, this person is not going to make it, this person's not going to make it. So the doctors or hospitals will start making the decisions to terminate.
That's a slippery slope, though. I think it's something that we've seen that the hospitals would not mind doing. I think we have seen that in our day-to-day lives. We just shared the example about how people are pushed out of hospitals because they can no longer afford their insurance.
But see,
so I don't even think it would be too much of a stretch of the imagination.
But the issue is, are we able to have the right to make a decision how we end our own lives when we are
the
facing?
Supreme Court told you no. You don't.
No.
They went to the Supreme
It's
Court
about
and
time. 2 minutes, guys, to close.
Oh, we're doing closing stuff.
Yeah.
Okay.
Yes. Thank you.
But speaking of that, before we close, according to here, the Supreme Court held an intense argument and they passed it.
If they passed it, they did not pass it over the span of the nation. It might have been an amendment to one case or an amendment to a law made in a state, but I'm positive that it was not across the nation.
Wow.
And close.
It's closing.
Are you done?
Yeah. All about that.
I mean, I have to close now.
Okay, well, in closing, I'm saying, what I'm saying is that an individual should have the right to make a decision about how their life is going to end if they are facing terminal illness, and you have a prescribing doctor and a consulting doctor in agreement on the diagnosis and the prognosis of
In
the
addition
person.
in addition to that, when people have the right to it, they also did research with the nurses in hospice to where people actually wanted to use euthanasia to go ahead and end their lives. And with pain, because they want to have controls over their, the situation, the illness, and also financially. That way their families won't, be burdened with financial responsibilities, as well as they know they never coming back from their terminal illness, and they are very uncomfortable with it. So they did researches, and nurses have reported back to those physicians that 69% of the not say clients, but the patients requested euthanasia, and they are for it, and their families are for it.
A lot of times these cases are done when people are in their terminal illness and they're not in the right mind. When you're ill, you usually
You want to close it, right?
go ahead. Okay.
Just in closing, I would say that, like we said earlier, this is too much. This is too tricky, and it's too much of a slippery slope, as she said, for us to allow something like this right now in our state of the nation.
Thank you.